My name is Ariba Khan and my roll number is EP1770018, and my presentation topic is Autologous hematopoietic stem cell transplantation. So, first of all, I will discuss what is autologous hematopoietic stem cell transplantation. It is basically a transplantation in which stem cells are removed from a person and then stored and then later given back to that same person, in which the donor and the recipient are the same individual. And so pre-transplantation and post-transplantation immunosuppression is unnecessary. And the next point is autologous hematopoietic stem cells must be obtained before the myeloablative preparative regimen is administered, and then stored for administration after the preparative regimen. Essentially, these hematopoietic stem cells are administered as a rescue intervention to establish bone marrow function and avoid long-lasting and long-term life-threatening marrow aplasia that results from the myeloablative preparative regimen. So, these are the following steps. So first step is stem cells mobilization, second step is collection of stem cells, and third is processing, and then 4 is conditioning and treatment, and 5 is reinfusion into patient. So first step is the patient gets treated with certain drugs that will cause the body to produce more stem cells, cause the movement of the stem cells from the bone marrow into the bloodstream. So next step is the patient's stem cells are collected from either their blood or bone marrow. So blood is taken from a vein in the patient's arm, and then these blood is the blood is processed through a machine that removes the stem cells, and the stem cells are frozen. The rest of the blood is then returned to the patient. In fourth steps, the patient receives high dose of chemotherapy with or without radiation therapy to kill remaining cancer cells, and also gets rid of the blood producing cells that are left in the bone marrow. And then in 5 step is reinfusion into patient. The frozen stem cells are thrown and infused back into the patient. The stem cells travel through the bone marrow and begin producing new blood cells. So other one is indications for analogous hematopoietic stem cells transplantation. These are the following indications. First one is malignant. These includes NHL, multiple myeloma, AML, Hodgkin disease, neuroblastoma, ovarian cancers, and germ cells tumors, and some other diseases like autoimmune disorders and amyloidosis. These are some myeloablative preparative regimens. So this one is for non-Hodgkin lymphoma. So this regimen is BEAC. This include carmustine, etoposide, cytarabine, and mesna, and according to these doses. So this is case study in which 46-year-old man has diffuse large cell B cells non-Hodgkin lymphoma in first relapse after complete remission of 1 year duration, and at 80% of reduction in miserable disease is noted after 2 cycles of dexamethasone, high dose of cytarabine and cisplatin salvage the chemotherapy. PG's bone marrow biopsy and lumbar puncture are negative for malignant cells. Is a myeloablative preparative regimen with autologous HST was indicated for PJ. So subject is age of patient is 46 and gender is male, and object vital organ are not given in this case study. So our plan is PJ has minimal residual disease that has demonstrated chemotherapy sensitive long-term prognosis will be improved with autologous PBPCT rather than further conventional chemotherapy. This autologous PBPCT is indicated, thus the shift to the use of PBPCS over bone marrow for autologous hematopoietic stem cells transplantation is primarily because of the more rapid engraftment and less invasive collection method. So these are some complication or side effects associated with autologous hematopoietic stem cells transplantation. These side effects are bone marrow suppression, some infections, veno-occlusive disease of the liver, and intestinal pneumonia syndrome, graft failure, and some are long-term side effects of autologous stem cells transplantation. It includes infertility and some other side effects. So this is my presentation. Thank you.